And let's go back to this chart here. It shows the number of COVID hospitalizations over the last year in Arkansas. It's never been higher than what we're seeing right now. Last spring, things looked promising. Many thought the pandemic might even be nearing an end with that vaccine becoming widely available. But then about 5 months ago, I held a roundtable discussion. I was talking to all these healthcare heroes about hope and how excited they were, right? Well, fast forward to today, I sat back down with some of those people, and we see a pandemic far from over, rather one really in its prime. Our eye-opening discussion is a THV 11 Morning original. So I was here about 5 months ago, and there was a mix of emotions of exhaustion, excitement, and most of all, hope. Now I'm back 5 months later. How are you feeling today?
Today, defeated. Delta variant entered into Arkansas, and we are worse today than we were 5 months ago.
I would say disheartened. You know, I'm an Arkansas native. I've lived here most of my life. I know that we are rugged individuals in a lot of ways in this state, but I had always thought that we pulled together as a society.
School's opening back up. I'm very concerned. I'm concerned as a healthcare professional, concerned as a parent of small children. I think I'm concerned.
That's interesting because it's like as it's gotten worse and more people get infected, it's almost opened the eyes of more people to see, oh, this could happen to me or my family.
Watching a grown man cry, saying, my daughter's in the hospital at Children's and it's my fault. If she doesn't make it, how am I going to live? Hearing these, that's not a unique story. Every day, there's 5 of those. Yesterday in clinic, very healthy guy asking, how are you doing? You doing okay with COVID? I'm burying my son tomorrow. He said, I wish I would have tried harder to get him vaccinated.
The ones that I really have to control myself on are the ones where, well, I just didn't take time to get the vaccine. Or, my wife and my kids got it. I've never gotten a cold in my life. I didn't need to take this seriously. And now they've got family members or they're critically ill in the hospital.
Obviously here this last week we have seen a jump in people getting vaccinations. What are conversations that you've been having?
This is a new virus. This is a new pandemic from 5 months ago. People are getting infected much easier. They're getting much sicker, worse outcomes.
Just coming to the realization that what some may have painted as a hoax or an overplayed hand of cards, this is real.
6 months from now, ideal situation, where will we be in the state of Arkansas?
What would that be? December? Oh, Christmas time. All right, holidays. My gosh, that was terrible last year, wasn't it? No grandparents, no distant family get-togethers. We don't need to do that again, but if things don't change, I don't see a difference.
I would like to say that this, what we're experiencing right now in Arkansas, low rates of vaccination, high rates of, the spread of the Delta variant, I would love for that to be a cautionary tale.
If we go down the route of people actually taking up the vaccine, wearing their masks, social distancing, wash their hands, do all of those things that we ask people to do, then we will get through where we are now if we don't see a big surge coming out of the schools.
We've been doing this for a year and a half. We're familiar faces. Everybody hearing this message has probably seen one of us say this before, and if it didn't work last time, it may not work this time. We need more people who have changed their minds about vaccination to be super spreaders of information.
Is there anything that one positive the doctors noted is that although the situation is grim, doctors are getting better at treating COVID in life and death situations, but vaccines are still the best shot of staying out of hospitals. However, there is one treatment the FDA has granted authorization for in the outpatient setting, monoclonal antibodies. So if you do get infected, there's proven data that you will have a 70% decrease in risk of progression to admission or death if you get that monoclonal antibody treatment.